Assalamu alaikum. Now I would like to discuss about a very high yield topic. First, read this question. A 48-year-old man comes to the office due to why? Pain in the right hand. Okay. Uh, He has had symptoms intermittently for the past year. Okay. The pain radiates to the anterior aspect of the forearm. Pain radiates to the anterior aspect of the forearm. Mm, He has diabetes, type 2 diabetes, one of the risk factor of these cause. Okay, he works at the retail supermarket where he is reasonable responsible for stocking heavy canned goods. Okay, now the examination. There is weakness in the thumb opposition. There is weakness in the thumb opposition and slightly decreased touch sensation over the palmar surface of the tip of the thumb, index finger, middle finger. Looks like area of the median nerve supply. Sensation is normal elsewhere. What is the most likely diagnosis? Looks like it is carpal tunnel syndrome, but carpal tunnel syndrome, there is compression of the median nerve at the carpal tunnel. There is another syndrome where there is compression of the median nerve, but this nerve compression happens in the forearm, which is called pronator teres syndrome. Okay, I will discuss these two in detail, like carpal tunnel syndrome, CTS. It happened due to obesity, pregnancy, rheumatoid arthritis, diabetes, hypothyroidism, end stage renal disease. So, obesity, pregnancy, uh, diabetes, hypothyroidism, rheumatoid arthritis, and end stage renal disease or hemolysis. There is pain and paresthesia in the median nerve distribution. First three half of digits, positive phalline tenile or darken test. Darkel, that means carpal compression test. In severe disease, there is weakness in the thumb abduction and opposition. There is weakness in the thumb abduction and opposition. There is atrophy of the thinner eminence. So in severe disease, there is there is uh, weakness in the abduction. There is weakness in the abduction and of opposition and atrophy of the thinner eminence. Confirmatory test, conduction study, and treatment risk splinting, glucocorticoid injection, and surgery for severe refractory symptoms. Okay, this carpal tunnel compression of the median nerve when it passes deep to the flexor retinaculum in the wrist. When it passes deep to the flexor retinaculum in the wrist. Okay, this is the carpal tunnel. There is palmar cutaneous branch of the median nerve. This is transverse carpal ligament or flexor retinaculum. Transverse carpal ligament or flexor retinaculum. This is median nerve. This is palmar digital branches of the median nerve. There is sensation. Look, the median nerve supply, the motor function, the cutaneous innervation. In motor function, there is thumb flexion and opposition. Also contribute thumb abduction via abductor pollicis brevis. So thumb flexion, opposition, and thumb abduction via abductor pollicis brevis. And there is flexion of the first, the flexion of the two, second flexion of the digits of the second and third, flexion of the digits of the second and third. There is a wrist flexion and abduction, wrist flexion and abduction, and forearm pronation. These are the motor function of the median nerve. Again, thumb flexion and opposition, and thumb abduction via abductor pollicis longus. There is forearm pronation. There is forearm pronation. There is wrist flexion, and wrist flexion, wrist abduction, and flexion of the second, flexion of the digits of the two, second and third. This is the palmar digital branch. This is in here. There is palmar cutaneous branch. Okay, this is tinel test. Light tapping elicits tingling sensation in thumb, index, middle, and part of the ring finger. Darken manual compression, and this is phalanx test, also known as prayer sign. Reverse prayer sign. Flexion of the wrist compresses the nerve inside the carpal tunnel. Okay. As the disease progresses, uh, there may be thinner atrophy and weakness in the thumb, abduction, and opposition. Okay, the similar feature is pronator teres syndrome, median nerve compression in the forearm, very, very, very high yield. In here, there is median nerve compression at forearm, median nerve compression in forearm, pronator teres syndrome. This is pronator teres head. This is pronator teres ulnar head. This is pronator teres humeral head. Okay, what happens in here? It causes forearm pain and sensory loss in the palmar aspect, and sensory loss in the palmar aspect of first three diseases. However, additional sensory loss. There is forearm pain and sensory loss in the palmar aspect of the first three diseases. However, additional sensory loss over the lateral palm and thinner eminence would be expected due to involvement of the palmar cutaneous branch. So the sensory loss over the lateral palm, and thinner eminence would be expected due to involvement of the palmar cutaneous branch. So these there is sensory loss due to involvement of the palmar cutaneous branch. So that is all about carpal tunnel syndrome and pronator teres syndrome. These two is a very, very, very fantastic topic, and most commonly this type of question found in the upcoming exam. Hope you enjoyed.